Doctors and nurses have read it. What have been your why did not you come in sooner moments? Imaging guy here. I have a million of these. I work with vascular patients and wounds. Had a guy whose foot was completely broken sideways at the ankle. He had it still wrapped from when he left the hospital. He would use the stumpy part to move around on his wheelchair and leave little blood sponge prints on the floor. Another guy with bad ankle and foot wounds decided to stop going to wound care, and was afraid to take the wraps off even after his foot started to stink. By the time I saw him his skin had kinda liquefied. Earlier on in my career I saw a guy with necrotizing wounds to both legs that had eaten to muscle in multiple places below the knee. I asked him how long they looked like that and he said about 2 years. Next time I saw him he was bilateral above knee amp. Stump wounds. Just stump wounds. Take care of your feet, people. If you are diabetic and cannot feel the bumps and scrapes, please check your feet regularly. Former medic here, called to a patient who had cut their leg while chopping wood about a week prior and now it was really itchy. Old gentleman, didn't he drive, lived alone, got to his house, unwrapped the ungodly swollen leg to find that he'd tried to superglue the wound closed and maggots had commenced to growing inside. The itching he was feeling was the writhing maggots under his skin. Guy came in with a dead leg, waited until it turned black and then decided to head to the ER. They tried an angiogram to open up blood flow but it was way late for that. Guy had several clots in his lungs and legs, undiagnosed atrial fibrillation. He could not believe we were going to amputate, kept asking me what else I could do, go back in time a week ago and come in, kinda around when it turned blue. This happens all the time. People have a big stroke at home and cannot move an entire side of the body. They wait several days thinking it is a flu or something. Nope, not the flu, just a large clot in the brain that could have been reversed if you came in right away. Doctor here, might be a bit late and will probably be buried but had a 65-year-old dude who was diagnosed with lymphoma 8 months before we saw him. He lived an hour out of the city and did not want to drive in for treatment so decided he would not get treated at all and stayed on his little remote place in the country by himself. Essentially, because it did not get treated, it spread along his skin and his neighbors called an ambulance when popping in on him. It had spread so far that it essentially went from his head to his knees. It had started to invade his eyes and mouth membranes. He could not drink and could barely see. His skin had started to slough off and he was so severely dehydrated because he was losing so much excess fluid from his open skin that we had to treat him like a severe burns patient and had plastics involvement. The consultant said if he had received treatment, there was a chance he could have recovered. Instead he died 3 weeks later. Years ago as a nursing assistant on an oncology floor we had a guy admitted because he had had an erection for several days and had lost the ability to pee. His bladder was close to bursting and his poor junk was, think microwaved hot dog, really bad. But none of that was as interesting as the fact that this guy had untreated skin cancer on his nose for several years that had over time become infected, developed MRSA, and spread across his face. He had no nose, no cheek, and no eye on one side of his face, and was starting to lose his other eye. You could see part of his ducking skull. I don't know why he chose to leave it untreated and I have no idea how long it took to get that bad, but I will never ever forget the smell and texture of his rotting face. On the upside, we were eventually able to convince him to have reconstructive surgery. He ended up getting a skin graft that covered up his eye, nose and cheek. So, if you ever meet a very grumpy dude with nothing but a mouth and one eye, know that this is way better than the alternative. Once had an older lady call in wanting a prescription for pain meds because she was sure she had shingles. Said her neighbor had them and she was sure that's what it was. She hadn't been in for an exam in almost 2 years, so the doctor asked that she come in to be evaluated before a prescription could be given. She refused and called again the next day asking for a prescription. This went on all week, her calling for pain meds, the doctor asking her to come in to be seen. She finally agreed to make an appointment. It wasn't shingles. It was a skin ulceration from advanced breast cancer. This has happened a few times, actually, but I had a gal come in on Monday after being discharged from the hospital Friday after giving birth. So basically, We tell ladies to avoid intercourse until a doctor clears you, and well, her spouse kept insisting that Friday night she caved and let him go to town. He wound up tearing some stitches that were placed and bleeding like a stuck hog all weekend long. Came into our clinic, blue in the lips and fingers, and her hemoglobin was for normal should be 12-15. She did not want to be a bother, so she waited until she started feeling dizzy all the time. She got another trip to the hospital for transfusion and repair for that. But, like I said, this is not the first time I have seen that. So for the love of God, if homeboy is begging for it after you just had a baby, maybe he needs a lesson in self-control and a bottle of moisturizer. I've seen a few over the years, and they generally fall into the category of if it has not diagnosed then I can't have it, or I didn't think it was that bad. As a medical student I remember an older lady that had a breast that was necrotic and falling off. It had been progressing over the last several years, but, if she didn't get diagnosed with breast cancer, then she couldn't have it. In the other category I've seen a few cases of Fournier's gangrene, pretty much obese, male diabetics that had a pimple sore that started in the pubic region. By the time they come to the hospital it has a raging infection where the treatment is basically to cut away everything in the pubic groin region down to the muscle layer. That little sore didn't seem like much at first. Not a doctor, hospital staff, but my grandpa ended up passing away because he waited too long before going to the hospital. This was about 17 years ago. He was tending to one his meals when something spooked it and he got kicked in the gut. He was in a lot of pain, could barely move due to the abdominal pain, so decided to take it easy and lounge on the couch for a week. He refused to go to be taken to the hospital. Unfortunately, that mule kick ruptured an unknown tumor in his intestines. The doc said it was huge, like volleyball size huge, and he may have survived if he came in sooner. By the time we got him to the hospital he had a severe case of gangrene. His leg needed to be amputated within a day of him being there. He passed away a week later. We once had a patient who went to emergency for abdominal pain and they discovered a fungating breast wound. Do not image search that she had had for 2 years and had not gotten medical attention for. A biopsy and a PET scan later she was diagnosed with breast cancer with extensive liver, lung and bone mets. This was also in Australia, so it was not a money issue, just sad. I am a doctor, and while working in AE we had an older chap, possibly in his 70s, who several days prior to presentation had a sudden onset severe chest pain and vomiting while loading the car with shopping. He ignored it and struggled home. The next day he started to lose the use of both legs, and by the time he came to hospital had been crawling around his house for several days because he thought it would get better. He had had a major cardiac event, developed a clot which his heart had pumped out. It went down his body, broke in half and blocked off the blood supply to both legs. He literally had dead legs. I do not know what ended up happening to him, but there was no way to save the legs, and I reckon the outcome was very poor, if not fatal. Edit, because there is a lot of US assumption going on. This is in the UK where healthcare is free at point of access, so debt is not a contributing concern for our patients. Children's nurse here. My first week in pediatric ed we had a young girl 6'7" come in with a really swollen jaw face. Poor girl was unable to move her jaw without intense pain and hadn't been able to eat for several days. Turns out she had only just started cleaning her teeth for the first time ever and managed to develop several abscesses and rotten teeth in the process. To make it worse, her mum told us she was recovering from the same procedures to remove most of her teeth because of almost the same thing. They didn't want to bother the GP as they thought she was just messing about to get out of school. Had a patient brought in by her son who took care of her. When she arrived to our unit I performed a skin assessment, took off her socks and found a fallen off gangrenous toe. Seems fake and I wish this was, but it was by far the nastiest thing I've witnessed. Son said he had no idea when his mother's foot became that bad. No words. Elderly woman fell at home and broke both femurs. Son thought she just needed to rest, so he carried her to her bed. She laid there in her own filth for 3 days before anyone called 911. The son lives with her, and there's family next door as well. How? WHY? Obligatory not a doctor. I was sitting in a hostel with an emergency nurse and an emergency doctor that had just found out that while they worked on different continents, they did similar work. We were happily chatting along and this older guy walks in. He overhears that they are in the medical field and comes up to see if he can ask a question. He shows them his leg that has got large black spots on it everywhere below the knee. Both the nurse and the doctor look at it and immediately go, "You have to go see emergency services. That leg is necrotic. You will lose the leg if not your life." And the guy goes, "Ha, that is what my doctor back home said too, but the leg feels fine. I did know if it was dying." "You are wrong. Besides, I am not gonna ruin my vacation by seeking medical treatment," which left me wondering why he asked in the first place. He goes to sit at the bar and over the course of the evening both the nurse and the doctor leave the table to try to get this guy to understand that he may not have 10 days until he is back home, that he needs to have this looked at now without success. Pretty sure that if that guy made it to a hospital, they ask themselves that question. Obligatory not a doctor, but I have a story about myself. I got really sick really fast, but did not realize it. I had stage 4 Burkitt's leukemia CNS positive, which is very important to know. Less than 100 people my age will get that cancer each year in the USA, so pretty uncommon. Anyway, I got super sick just over a year ago, and just happened to have a doctor's appointment scheduled. Went to the appointment and felt like absolute trash. Sweaty, hot, lethargic, lightheaded, terrible heartburn, and just tired. Also could barely breathe. My dad, who was driving me to the appointment, had to wake me up and I remember him saying, "Get up, Fatis. We have a doctor's appointment to get to. You better be ducking sick." In his defense, he had no idea and neither did I just how sick I was, as 2 weeks before I was fine, working in South Carolina on a construction job. So we get to the appointment and I get blood work and an ultrasound of my chest cavity. The doctor saw the ultrasound photos and was stunned, then saw my blood work and told me to get the duck back to the hospital, as we left to go home and would hear the results later. Doctor saw 7 tumors on my liver, the biggest on the size of a grapefruit and the second largest the size of a baseball, and then saw my blood work was trashed. Diagnosed me with cancer and said it was a miracle I was awake, let alone walking and cracking jokes. Only found out later that Burkitt's cell can double in size within 24-48 hours. Doc wondered why I had not had problems with my monster tumors before, since I only scheduled the appointment to fix heartburn. Too long didn't he read I made a doctor's appointment for heartburn, got diagnosed with super cancer. Consider subscribing if you enjoyed this video and if you want to see more of Reddit Universe.